This panel will feature leaders who are working across sectors in food and health and talk about how innovative partnerships can advance food as medicine initiatives. So our first panelist is Mike Dandorph, President and CEO of Tufts Medicine, a leading integrated health system bringing academic and community health care to consumers across Massachusetts. His career spans 3 decades of service to academic health systems. He's highly regarded for executing broad transformational change that incorporates innovative partnerships, high-performance teams, and a relentless focus on consumer-centric patient care. Dr. Nira Goren is the head of health information quality at Google, where she leads a team of clinicians focused on tackling health misinformation and ensuring the quality of health information across Google's platforms like search and YouTube. Nira is also leading Google's new Food as Medicine initiative, which aims to facilitate the development of products and programs that will improve nutrition information quality and further access to high-quality food through collaboration with key partners in the food as medicine space. A pediatrician by background, Nira was previously at Google DeepMind and the Boston Consulting Group. Pam Schwartz is Executive Director of Community Health for Kaiser Permanente. She leads the organization's national food security strategy and other social health priorities, including ensuring that social health interventions are integrated seamlessly into care and services provided to Medicaid members and across all lines of business. Under her leadership, Kaiser Permanente has designed, tested, and scaled numerous outreach campaigns to enroll members in public benefit programs. Pam also oversees Kaiser Permanente's $50 million Food as Medicine commitment made alongside its role in the White House Conference on Hunger, Nutrition, and Health. An early advocate in the food as medicine movement, Pam has helped establish the evidence base and business case for addressing food and nutrition insecurity at Kaiser Permanente and in healthcare systems across America. Brooks Tingle is President and CEO of John Hancock, the U.S. segment of Toronto-based Manulife. Based here in Boston, Mr. Tingle leads John Hancock, one of the largest life insurers in the United States, in supporting more than 10 million Americans with a broad range of financial products, including life insurance and annuities. Prior to becoming president and CEO, Mr. Tingle led John Hancock to embrace and implement the company's now market-leading behavioral insurance solution, John Hancock Vitality, which offers life insurance customers significant savings and rewards for taking everyday steps toward a longer, healthier, better life. Dan Glickman, former U.S. Secretary of Agriculture and chair of APCO Worldwide's International Advisory Council, is the former executive director of the Aspen Institute Congressional Program, a non-governmental, nonpartisan educational program for members of the United States Congress. Secretary Glickman served as a member of Congress from Kansas from 1977 to 1995. Secretary Glickman also serves as a senior fellow at the Bipartisan Policy Center in Washington, D.C., formed by former Senate Majority Leaders Howard Baker, Tom Daschle, Bob Dole, and George Mitchell, to develop and promote bipartisan solutions to the country's problems and to promote civility in government. Please join me in welcoming our panelists, and I'll now hand it over to our session moderator, Secretary Dan Glickman.
Okay, thank you all. The introduction was great until you got to civility in government. I think what a hell of a job I've done in that area, right?
Keep trying.
Yeah, keep trying. Anyway, it's such a delight to be here, to be with Chris and Dari and the whole team in this exciting creation of an institute which can have a transformational impact on our healthcare system and the ability of people to live longer and healthier, which is our goal. And this is a kind of a complicated issue. I'm glad we started with some of the patients, the people who've received the benefits, because we've seen how it impacted their lives. Now we're going to see how the institutions of America, so to speak, health and others, can interrelate to all these and how it interrelates into their lives. This is not an uncomplicated issue because you're talking about all sorts of issues. The role of providers. Do they know anything about the subject we're talking about? And are they willing to intervene in those decisions? Marketing and advertising of foods, education, science, federal and state programs, schools. I mean, it just goes on and on forever. And my interest, of course, is in policy. So how all of what we're talking about is going to help policymakers, not only in Washington, but the state and local level, as well as the private sector and the nonprofit world, cope with these things. So it's really important what we're talking about here. So Michael, I want to start with you. I was going to say you run the medical programs at Tufts. I don't know if you think you run them all, but you're at least at the top of the food chain, so to speak, of all of this. So I'm just curious, why did Tufts decide to go down this road of creating a food institute? And where do you see this thing going in terms of your infrastructure and healthcare at this institution?
Well, thank you. And run would definitely be an overstatement.
Yeah.
So, but really, what I'm trying to do is set the stage to set a different trajectory for healthcare. And at Tufts Medicine, what we're really trying to do is be a protagonist in what we need the healthcare industry to look like. You introduced me as the medical enterprise, and I think we provide great medical care in the United States. But we really do fall short when it comes to healthcare. When you think of health outcomes, the costs of healthcare, the experience of healthcare being very fragmented, and we've siloed the way that healthcare is organized in a lot of ways. Again, do we provide and do great things for patients from a medical lens? Absolutely. And we do that here and across the street and in other parts of our network. The interest around food as medicine, particularly for me and for our health system, is our commitment to population health and really thinking about the experience of healthcare from a population science and a population health perspective. How do we address the costs of healthcare so that we can create more affordable, accessible services? How do we improve the health of populations in a way and start to think about food as an element of that? And how do we embed this into our care processes? Because it can't be a standalone initiative that sits on the side. It really needs to be integrated in our processes of care. Otherwise, it's just going to become more burdensome and one more thing for our physicians, our nurses, our care managers to do. So we're really working closely with Dari and his team and a number of other partners on how do we integrate the work of getting healthy foods and targeted foods from a prescription perspective into the care process. And we believe that will not only improve the populations that we serve, that it'll also address health equity issues, which is also something that we're very committed to given the diverse populations that we serve in Eastern Massachusetts. So these are all really important things that we need to embed operationally into the work.
And would your goal long term scaling this up so it's just an integral part of your entire healthcare practice, teaching, providing counseling, just the whole impact that will have on consumers as a whole in this country, whatever the income level they're in? Do you believe that this can be scaled up into something that's very comprehensive?
Absolutely, and there's several pilots that we're initiating again with Dari and others' help to really think about how do we measure the work that we're doing. We're an academic health system, so research is incredibly important to us. We think about how do we become more of a learning health system. We're very close partners with the university in a number of aspects. Food is medicine, and this institute is an important one. Our Clinical and Translational Science Institute is another. And what I mean by a learning health system, when we really think about how do we embed this work in clinical practice, is how does research influence practice and how does practice influence research? And it's got to be that closed loop process. So we need to be as committed as providers to participate in that research and that ongoing learning so that we can scale what works and frankly stop what doesn't work. And that's part of our challenge, right, is we continue to add more and more things to our providers' plates, but we're going to need to be able to take things that don't work and sunset those so that we can focus our resources and energies to the things that do work. And the promise of food in that is incredibly important, and the potential is just dramatic. I get excited every time I sit with Dari. I remember the first time we met, we were sitting at a Starbucks. He got a green tea and I got a macchiato. I felt bad ever since.
Well, the old expression is, when you look in the dictionary into the word enthusiasm, his picture is there. So Brooks, okay, so your role. I've been on a panel with you, I think, here before. I know you've been a big supporter of Dari and all the work that Tufts has done in this area. But the insurance industry is actually pretty key in determining whether there's an infrastructure to actually get this done. I mean, you have the federal insurance part, which is Medicare and Medicaid and related programs, but 80% of the people are not in those programs. They're in the private healthcare system. How do you think that you interface with what we're talking about today with the work of companies like John Hancock and others?
Yeah, well, we do. First of all, I love Dari. Hanging out with him is a real challenge if your diet's not up to snuff. I had
Eat before you meet with them. That's the idea.
I had really a real pleasure of taking Dari and his family to a football game recently, and tailgating with Dari is not something you want to do. I think he would describe my tailgate as food is poison tailgate. But anyway, so yeah, well, we play. So John Hancock, 161-year-old company, headquartered just down the street. Really honored to be here. And we offer a diversified range of financial solutions, but the offering that we have that we think is just hugely relevant to what Tufts is doing is our life insurance offering. Anybody here own life insurance? Yeah. Well, let me tell you a little secret for those of you that own life insurance. Beyond your immediate friends and family, there's no one that wants you to live a long, healthy life more than me and my colleagues in the life insurance industry. I tell you how the business works. You pay us a premium, we invest those premiums. Someday you die, we pay your beneficiaries money. The longer we can invest those premiums, the more money we make. So given that fundamental reality, just being honest, so given that self-interest and that fundamental reality, it struck us as profoundly odd for the hundreds of years of history of the life insurance industry. We would issue policies on people, sit back and say, I sure hope they live a long, healthy life because that'd be good for us, but do absolutely nothing to try to affect that outcome. So 8 years ago, we launched a program referenced in my intro called the Vitality Program. It's an app. And think of it almost as like, really simply, as like a frequent flyer program. With airlines, the more you fly, the higher the status level you get, and you get different perks. You can board the plane early, get a nicer seat, what have you. I'm not sure there are many nice seats left, but it's the same concept except around wellness and life insurance. Everything you do that correlates with living a longer, healthier, better life, we're going to give you points for. Those points accumulate and you get a status. And that status level determines how much of a discount you get on your life insurance, but then the value of a range of other rewards, a free Amazon Prime subscription, travel rewards, you can earn a free Apple Watch, too much stuff to talk about. So when we launched it 8 years ago, there was a heavy emphasis on physical activity. Wearables were just becoming sort of the rage, so we gave everybody a Fitbit at the time and gave people points for physical activity, which we still do. And then the other point of heavy emphasis was points for preventative screenings, mammograms, colonoscopies, good biometrics, things like that. Well, we realized literally 1 year into the program, which some of us have realized the hard way, that you can't exercise your way to good health at some point. Nutrition is huge, and I guess you could debate which is I would argue, having hit 50, that nutrition is a bigger factor than exercise. Actually, you need to do both. But we had a real hole in our program as it related to nutrition. So we partnered with Tufts at that time and have had a wonderful collaboration with Dari ever since in providing our customers with the education, the tools, and really importantly, and you talk about the role our industry can play, the incentives and the rewards to make good choices. Our program offers discounts on healthy foods. If you're one of our policyholders, you can get a 25% discount on fresh fruits and vegetables at over 17,000 grocery stores nationwide. You go to the checkout, right on your receipt, $5 bag of apples minus $1.25 John Hancock Vitality. And
who paid? Did John Hancock pay for that?
We do, yeah. And the impact that we can have is proving. And Dari and I go to DC not infrequently and talk about the value of incentives and rewards. If you provide a discount on something, people will oddly use it, right? If you reward somebody for it, we also give points in our program for buying, healthy foods. People want to earn points because they want to get free stuff. So there are lots of ways we can play. I think fundamentally, first and foremost, We're proud to represent a whole industry that just hasn't been at the table for these discussions. And then I think we can share a lot of insights about the value of incentives and rewards.
That's great, and it's what you're doing is terrific. I know you're not necessarily heavily in the health insurance side of the picture, but they're a very key player in a lot of these subjects. I mean, what they reimburse people for, we heard before about Medicare or Medicaid not reimbursing, and so the health insurance industry is also a key part of this. Do you work with them at all in any of these issues?
Well, we sit on a lot of panels together. No. Yes, in different ways, particularly around certain innovations around early cancer screening and things like that. So we do. We need life insurers, frankly, I would argue, have the most skin in the game, because if you're a health insurer or you're an employer, like there are employer wellness programs, but the average employee stays at an employer now, I don't know, 4.8 years or something. The average length of relationship that we have with our customers is 24 years. We paid a claim recently where the client had been a client for 99 years. Parents bought the kid a policy on his first birthday, died shortly after his 100th. So we have literally lifelong relationships with our customers. So we can monetize better long-term health outcomes, frankly, in a way, I think even more so than health insurers, who have a little bit more, I'll let you speak to it, but I think a little bit more of a short-term dynamic.
Well, we'll get to Pam in a minute. I think you both are important, because if reimbursement's not available for a lot of things that can deal with prevention, then it's going to impact your ability to keep those people alive for a long period of time.
Correct.
So let me go to one of probably the most impactful and transformational companies now in America, and that's Google. And I've been out to Google, and I had lunch there a few years back, and they have this incredible campus. I don't know, how many of you have been to the Google campus? Okay, quite a few here. And, you know, they were ahead of the game in terms of their meals and in terms of employee relationships. But it's interesting to see, Nira, your position at Google. And I wondered what you might talk about why you do what you do at this company, which every one of us is involved with from morning till night. I mean, I do a search 55 times a day. And we're all in this world, and with AI coming up, and really the AI is a kind of a follow-up to the Google search. You know, it's just a more sophisticated way of doing it all. So talk a little bit about why Google is in this game.
Can you start by telling us what Dan searches?
Well, not today, certainly.
Unfortunately, I can't do that, but I'm not sure if this is on.
It's on.
Yeah, okay. So thanks. Yeah, great to be here. And like was said in the intro, my name is Nira Goren, and I lead our health information quality efforts at Google Health, and also our new Food as Medicine initiative that we are just launching today. So I'm really excited to be here and be part of this really important community. When we say health information quality, what we're referring to is the information that people find when they come to Google's platforms like search and YouTube with a health question. Google gets hundreds of millions of health-related questions every single day from people around the world, probably maybe from Dan, we're not sure. And we need to make sure.
As a matter of fact, I just want to tell you, this morning, I searched about the role of magnesium in our diet. And, you know, and I got about 1,700 different answers as I looked at that search. You know?
Hitting the nail on the head. And the question is, you know, how do we ensure that the information people are getting back is high quality? When we say high quality, we mean how do we ensure that it's evidence-based, that it's accessible? So that's what my team works on. And when I started working on health information quality 4 years ago, I was pregnant with my son. And it was my first pregnancy, and I wanted to do everything right, like all mothers do. And I knew that it was important to nourish myself with healthy foods. And you would think that as a pediatrician, I would have been armed with all of the nutritional knowledge on how to do that. But like I think Dan said, and maybe Dari said at one point, I quickly realized that I actually knew very little about nutrition because, like most physicians in the US, I had received very little nutrition training, which is a problem that I know the Institute is going to be working to solve. So I started reading a lot, and I started devouring the nutrition literature, information from credible sources online. And frankly, the only thing that became clear was that deciphering fact from fiction in the nutrition information space is no easy feat. And that's really when, I guess, all of my world as a mom, my world as a pediatrician, and my world as head of health information quality for Google collided. And I just thought to myself, it just shouldn't be this hard to know what to eat to be healthy. Google's mission is to organize the world's information and make it universally accessible and useful. And that includes nutrition information. We know that nutrition is critical to health. And if we can empower people, organizations, to make optimal food choices, then we can make billions of people around the world healthier. And so that is why we're really excited about this space. We recognize food as medicine as critical to this mission, and we're excited to be part of this community and try to accelerate this important field together.
So what would your, in terms of your, let's say, short and long-term goals in food and medicine be? To improve the quality of information in the search engine process? I mean, what are the kinds of things that you would do?
Yeah. So there are well-established social and structural determinants of health, as we all know, like housing and education. But the pandemic actually really highlighted an increasingly important determinant of health in the digital age, which is information. And when we think about information as a determinant of health, we recognize that Google, as a global information technology company, has the responsibility to consider how to continually improve our products so we can ensure that we are positively contributing to health outcomes. We know that 3/4 of people in the US turn to the internet first for health and wellness information. And that number is even higher in places like Indonesia, where 85% of the population is looking for health information online. And we know that people are asking a lot of nutrition questions. But like I said before, that what we would think of as the user experience is not great. It's very confusing. People find a lot of conflicting information, and sometimes there's misinformation, and it just makes it really hard for people to know how to make optimal food choices. And we want to make that easier. That's the main goal here, is to make it clearer and make it easier. And that's why we're really excited to be partnering with the Tufts Food as Medicine Institute, so that together we can explore how to utilize our technology to help provide higher quality information so that people and organizations can make optimal food choices. As part of this work, we will be exploring the role that artificial intelligence can play, including generative AI. And we're hopeful that this collaboration will help us progress the mission that we've been on, to provide up-to-date, accurate, useful information so people can make those optimal food choices.
Sure that Tufts is really delighted to have this partnership with Google. I think it's really important. Glad you're here, both as a medical doctor as well as with the largest tech company in the world, probably, or one of them, certainly. So Pam, you're no stranger to this subject. And, you know, I deliberately ended with you because Kaiser is not only one of the largest providers of medical care in the United States, but it's a source of innovation in terms of providing new and innovative and entrepreneurial options to deal with a lot of these issues. And you're at the forefront in a lot of the food as medicine. And I know you've got a lot of stuff going on, and new programs, as I think Dari mentioned one of them. You might talk about what you're doing in this area, especially the new stuff.
Yeah, well, thanks, Dan. It's nice to be here again with you and again with, well, and I've also had the matcha macchiato experience, so warning to all. Well, we've been in this space for about 5 years now, and one of the very first phone calls I made when I was trying to decide what is the what's going on in the area of, at that time, food as medicine wasn't the buzzword that it is now. So the question I was asking is, what should we do? What should healthcare be doing in the space of food insecurity? And I picked up the phone and I called Dari. This is 5 years ago, and it was I remember it very well. It was a very quick conversation. He said, do these 5 things. The first one was screen for food insecurity, and he might have mentioned nutrition insecurity, although it was still in the early days of that thinking. He also said connect to local organizations like food banks, et cetera. And then he said medically tailored meals. But he said, don't just do the interventions of medically tailored meals, but help to build the evidence, because the nation needs to know what works and under what conditions. And so we launched 4 medically tailored meal studies. He also said, connect to government programs. And so we launched an interactive texting campaign. We now have 125,000 people that we've helped to apply for SNAP. We've also been working on WIC and getting members enrolled with WIC and staying enrolled with WIC. And so that's a newer intervention. And then last, he said produce prescriptions. And that at the time wasn't very, Brent talked about it today. It was in the early days, 5 years ago. So it wasn't really something we fully understood. But Dari mentioned that we now have 2 produce prescription studies in traffic. The first one has just wrapped. It was with Food Smart and Instacart. Dari mentioned that. But it was delivering a curated box of produce prescriptions to a Medicaid population of diabetic or pre-diabetic for 6 months. And we're just analyzing the data. They're presenting it very soon, and it's seeing lower rates of A1C in a really hard to serve high-risk population. So it's a super exciting finding. Our clinicians are really excited about this. Our patients are really excited about this. And this also informed the second study that Dari mentioned, and that was our partnership with Instacart that was announced a couple of weeks ago. And this is where we wanted to take also a produce prescription study, but this time give the patient more choice. So Dari helped us to create a curated list of healthy items that then we could purchase through what is within the requirements of CalAIM, or the allowances of CalAIM. So it's $100 to Medicaid, Medi-Cal, in this case, members with diet-related disease, to use the Instacart platform to purchase those healthy items online, also layer their SNAP, have it delivered to their home, all of it, the SNAP, the curated list, and then whatever else they need, toilet paper, whatever else they're bringing home for their families. And then again, all delivered again for 6 months, looking at similar outcomes to the first studies. So looking at A1C, looking at utilization, quality of life, equity, behavior change. And so we're super excited to learn from that. We have another study that we've been planning for around the maternal and child health population in Georgia. This is also one of our harder to serve populations. We have a lot of health outcomes that are not going well in that population that we want to really explore. Is food as medicine an option there? And maybe I'll say one more thing, and then Dan, I'm sure you have questions, but just to say, we saw the data about diet-related disease, we saw the data about food insecurity, and we see the data in our own members. Dan mentioned that we're a large integrated health system, but we have 12.7 million members, and we know that they have a lot of food and nutrition insecurity. We know because we've asked them. We surveyed them recently. It was about maybe 4 months ago. And what we saw is that 25% of our members report poor food or nutrition security, and then or struggling, I guess I should say, are struggling with food or nutrition insecurity. And so that's 25%. If you look at the Medicaid population on Medicaid plans, then we see that number double. So it's 50% of Medicaid members. And so this is a lot of people, 12.7 million. You can do the math. It's a lot of people. And so we've been trying to look at interventions that can be scaled and that can be sustained into the fabric of healthcare. We have so much enthusiasm for this, but what's missing for us is understanding the evidence in ways so that you know which disease categories, which target populations, what's the duration, and all of that of the actual intervention that is the most impactful. And then we're also looking at what are the ways to scale it and sustain it and pay for it. So those are all the things that we're still challenged with today. And Tufts has been an incredible partner in helping us get into traffic and not only as thought partners, which I already mentioned, like telling us what to do, but also rolling up their sleeves from many of the people who presented even today. Ranit, Fang, all of you have been such incredible partners. Kurt, I saw you, I think, in the back, really helping us to build the evidence and think about how to scale this and operationalizing it into the fabric of healthcare.
Yeah, you actually answered my next question, which was on scaling this thing up. So we don't have very much time left, but I'd ask each one of you to start down at the end there in terms of making everything we're doing here and cooperating with Tufts in the process suitable so patients, consumers, after all, that's what we're geared for is health, and health relates to the individual health of individuals. How the best way we can do to as part of this food as medicine process so that we have an educated consumer. There used to be a store called Sims. Some of you may remember. They were a clothing store, and their slogan was, "An educated consumer is our best customer." And so I've thought, what do we do to help educate the public more in this area? Is there anything we can do as part of this institute to do that? You talked a little bit about that in terms of what Google's role is, because the millions of people who access the Google search engine all the time. But going down the list, what one or two things can we do to make it so that the average patient, the average citizen in America benefits from this?
Well, I think that the launch of this institute is critical to that endeavor. It certainly is for our mission at Google. And so I just want to thank Dari and the whole team because I think that the partnership that we can now have with what is truly the global center of excellence is what is going to allow us to figure out the best path forward to ensure that we are delivering the highest quality nutrition information to the consumer and provide that education so that when they are going to the grocery store, et cetera, they feel empowered and they feel like they know the choices that they want to make.
So information is the role of Google in this process.
Information is a determinant of health, and that is the role that Google can play.
Michael, what would you say the best thing to kind of, as we link all of this to actually improving better health, I mean, what's the best thing we can do to make the consumer and the patient healthier in this process?
I'd like to think that in the next few years, we actually start thinking of food as part of our continuum of care. It's not something nice to do. It's something that we actually need to do in terms of prescriptions. And as I think about that, there's a series of things that have to happen in order for that to occur. And I mentioned this before, but we need to embed screening and prescription into our electronic health records to make it easier for physicians to do that. And we're working closely with the Food as Medicine Institute now on how do we do that? What are the sorts of questions that we should ask from not only from a social determinants perspective, but specifically around nutrition. And we need to start to evolve the science. We've done amazing things in terms of targeted therapeutics. And we need to think about food as a targeted therapeutic. And that's what I mean by if we really could start to treat this as part of the continuum of care. And the more and more we can do that, I think we'll lower the cost of care, we'll improve outcomes, we'll improve the health of our populations, we'll really start to address some of these health equity issues. And there's plenty of money to put towards this. I mean, we spend $4.5 trillion on healthcare a year as a country. We just need a piece of that that's really going towards food as part of the Food as Medicine and improvement campaign.
Great. And Pam, one thought I had as you were talking is, how do we share these best practices that you're doing these studies that are out there? A lot of great stuff happening all over the country, and Tufts will be the center of that in terms of this issue. How do we get that out so that the medical community and the public know about it?
I mean, I'll say to your first point about Tufts, not only are they a great partner to all of us in the room, but they're really good at convening and communicating, writing, presenting, and so are all of us in the room. And so there's just a lot of all hands on deck that can help to spread this. But I wanted to actually touch on your earlier question because I can think of, I think it was said by Secretary Vilsack, there is a role for healthcare in communicating this to patients in ways that I think we're not taking full advantage of. We can see the open rates of our texts and emails when we tell people about SNAP, for example. And so we're getting higher rates of interest than some of other people that are making similar messages. So taking advantage of that, also thinking carefully about what needs to happen inside the walls of medicine or in the clinical experience, like clinical appointment, versus what can happen in other ways, and really thinking about that very creatively and innovatively. I think that's another thing. And then last, lived experience, planning everything with lived experience. So that is that was said today, but I just can't emphasize that enough. When we design these programs, we try and design with lived experience, and also that goes into how do we talk about it. So bringing that into the how we talk about it.
Brooks, we'll close with you. Would you have any thoughts about this particular area, about how best to not only get information to the patients, scaling it up, how to get patients and consumers engaged in all of this as well?
Sure. Two quick thoughts. One, I think we really need to think about behavioral science. I mean, the education is awesome. I'm so excited about the work you're doing. But there are elements of behavior and behavior change here that it's not just, trust me, when I was driving back from the airport from a trip last night about 8:30 and I picked up delicious pizza, I knew that pizza, intellectually, I knew it wasn't my best choice at that time of night. So
Was Dari with you? When you did this?
I assure you, I would not. I would have been forced off the road in a different direction. But education alone isn't it. There's complicated psychology that goes on around nutrition in particular, and how do we address that sort of behavioral change and sustained change. The second thing I would say, at least for those of us in industry, it's not enough just to serve our direct customers in these ways. I'm very proud of what we're doing to help our customers live longer, healthier, better lives, eat better, and so forth. But the reality is a whole bunch of Americans, if you have a life insurance policy with John Hancock, you probably absolutely don't need that discount. It's helpful and it affects behavior change. There's a whole segment of society that just doesn't have access to our products. And a quick story, here in Boston, there's a neighborhood called Back Bay where our home office is. Life expectancy, if you live in the Back Bay, is 92 years. 2 miles away, as a crow flies, is a community called Roxbury. And life expectancy there is 69 years, 23-year difference 2 miles away. So I would say those of us in industry have an obligation to not just serve our customers well, but whole communities. And I mentioned that discount program for buying healthy foods. Last year we matched every dollar that our customers saved with a donation to Wholesome Wave, actually last year. Right now, we're matching every dollar that our customers save with a donation to the New Institute and to World Central Kitchen. So industry can play a direct role with their policies and helping public policy, but we also have to make sure we're serving everybody.
Well, this has been a great panel. Thank them all for their great work.